My name is Eduardo Lugo. I am a neonatologist at the Neonatal Intensive Care Unit at Florida Hospital for Children. In general, in the United States, about 10 to 12% of all babies are delivered prematurely. Not all of them require intensive care because some of them are delivered close to term and they do well, but many of them do require admission to the NICU. In our neonatal intensive care unit, we admit an average of 80 to 90 patients per month, and of those, the majority are premature patients. And some of them need to be delivered prematurely because the mother has developed complications, while others need to be delivered prematurely because the babies inside the mother are showing signs that they're not doing well and they need to be delivered for that reason.
Talk to me a little bit about some of those medical reasons. Is it more often that you find that it's the baby that's health is in jeopardy, or is it the mother's health in jeopardy?
Probably most of the time is a mother that presents with preterm labor, frequently for unexplained reasons, although sometimes can be explained by, for example, one of the most common causes of premature labor is having twins or multiple gestation like triplets. And then that's probably the majority of the cases. The minority, although still a significant amount, are the babies that need to be delivered because the mother has developed hypertension or preeclampsia.
What is your advice or encouragement for parents of babies? I'm sure it's a hard time for them.
This is a very stressful time of any parent's life. We realize that. My advice to them is when they come into our neonatal intensive care unit is that we're going to keep them informed about everything that is happening. They're going to be participating in the decision making. We will not do things to the babies that they don't want us to do. And frequently these parents spend a lot of time at the bedside. They know the babies better than anyone else. So they're a very important part of the healthcare team. So they will be participating. We understand their feelings. We're going to be with them trying to support them as much as possible. Most of these premature babies go home to live healthy, normal lives or have minor problems that I guess even many of us may have, even though we're not premature. A small percentage, a smaller percentage, are babies that either don't survive or survive with moderate to significant long-term problems. And usually those are the ones that are the most premature of them. We will just be with them. We will support them. When they go home, they will be referred to a team of specialists that are going to be following them. And just to know that we are with them in this process.
Absolutely.
The most enjoyable part of my job, to me personally, is the relationships that I develop with the parents of the babies. Many of these patients stay in the hospital for weeks, months, and we see them, many of them, every day. So we get attached to the baby, we get attached to the parents, and those relationships are the most rewarding to me. They go home, they bring the baby back, even though we don't see them after they go home for their medical problems. But those are the relationships that make my job worthwhile.